All right. So again, thanks everybody for being here today. I'm going to go ahead and open up our meeting to any partner announcements or events or activities that you all have coming up. We have some new folks on today. So also if you're willing to share about your programs, please do that now. And then we will move into our speakers after we share our events and updates.
I'll go ahead and jump in real quick. This is Marissa with Village Behavioral Health, and we do residential treatment for adolescents ages 10 to 17, boys and girls. And currently we are open across all of our programs and all of our beds. We focus on mental health and substance use disorders. So I just wanted to let you guys know, we can't promise immediate availability, but usually for our facility, we can get you an answer in like a couple of hours. And then of course, the longest part is waiting on insurance to see if they'll pay for the treatment. So if you have any questions, my contact information is in the chat and reach out to me. Thank you.
Hi guys, it's Tia with Carter County Drug Prevention. I was just reminding everybody we have our International Overdose Awareness event on August the 31st from 6 to 8 at the Covered Bridge Park. So we are still looking for more vendors. We have a good chunk of vendors coming. However, I would like to make sure that everybody in the community, the treatment centers, the recovery homes has access to some of your programs. So we're going to have free hot dogs, free ice cream, free bouncy houses, free live music. So it's just going to kind of be an event for everybody to come and hang out together for the evening. So we're going to talk about this more in Committee A today. So if you are willing or want to have a table at this event, please just reach out to me and I will put my contact information in the chat along with the flyer that you all can pass around.
Hey guys, it's Ashley Arnold with Tennessee Voices Survivor Connection program. We are currently accepting referrals for the program. All of my information is in the chat. There's no age cap on people that we can see. The program's for 90 days and it's completely free. So if you have any questions or anything like that, my email is in the chat. Thank you.
Hey guys, this is Gabby Smith. You guys probably remember me from the community college human trafficking. I have actually started a new job with the Tennessee Commission on Children and Youth. So if you have any interest in joining the Northeast Regional Council, I've put my number in my email chat.
Hi, everybody. My name is Kathleen Arwood. I'm with the Association of Infant Mental Health in Tennessee. I'm the community liaison for Upper East. We are a mostly DHS-funded nonprofit that serves anybody working with children prenatally through age 6. So any service providers, primarily we focus on reaching out to our early education providers, early interventionists, home visitors, but we provide training resources and advocacy related to the early relational health for children. So we have some free trainings coming up. We host at least a free virtual training a month. And the one that we have coming up on August 16th from 1 to 2, it's online. You can access that on our website. It is called Stories from the Field Emergency Preparedness Toolkit, which is the free toolkit that we have online as well. And we just came out with one for our home visitors. So kind of going through how to prepare children for emergencies from that social emotional well-being perspective, how to respond in emergencies, considering their mental health, and how to kind of debrief after an emergency as well. So that's a free toolkit online anybody can download. And we're going to have a training on that on August 16th from 1 to 2. All of our trainings are virtual. They're all free. If you can't make the live version, you can sign up and register for it, and we'll send you a recorded version as well. On August 25th, we'll have another training about reflective leadership for organizational well-being presented by Allison Peak of Ally Behavioral Health, and that's from 10 to 1 on August 25th. One other thing we do is we offer a free resource map related to infant and early childhood mental health resources on our website, and it's broken down by county. So I'd invite any of you, if you'd like to be on our resource map and you don't see yourselves on there, please do reach out to me. Or if you see any information about your agency that's not correct as well, you are welcome to reach out to me about that. Last thing, we do provide trainings. We have a training request form on our website as well, if that's something that you'd like for us to come and train your agency about, and we can touch base about that via that training request. Thank you so much.
Thank
I
you.
will go next.
Yep, go, sorry.
Oh, you're fine. So as you all know, we have been going through our county health assessment in the Carter County Collaborative Group, and we have been collecting surveys since April 17th, and I want to let you all know that we are closing that up today and tomorrow. Tomorrow, I will be in the county picking up what's left of the paper surveys. So if anybody on here has any paper surveys they need to turn in, please let me know, because I'll be in the county tomorrow picking those up, and the survey will officially close tomorrow by 4:30 p.m. I will get all those inputted tomorrow. But I do want to say a big thank you to everyone who's helped in this process. But yeah, if you can reach out to me via email or on the chat, just let me know if you have any that need to be picked up, and I will try to swing by and grab those tomorrow.
This is Kathy Campbell with Northeast Community Credit Union. I would like to invite everyone to come to our monthly networking meeting. Tia came and spoke Wednesday, and it was so wonderful. And it was so wonderful that people there in the community could hear about her. So it's always the first Wednesday of each month. We meet at the Chamber of Commerce from 8 till 9.
Tia, did you pay her to say that?
Only a little bit.
No, it's the truth. It was amazing. It was absolutely
I have no doubt.
great. People want to get involved and do some things. I've heard a lot of great comments. And see, I think a lot of people in the community don't know all the wonderful things that all of the agencies do. And so you have a chance to come, and, you know, you can even be one of the 10-minute speakers, and you can really have time to tell your story in 10 minutes and secure help and just reach out and let people know all the good that you're doing.
Thank you, Kathy. Anybody else have anything to share before we move into our speakers?
Yes, I would like to ask Kathy what the best way to contact her would be, like through phone or through email.
I'll tell you what, I will put up Andrea's email address, and she could invite you to the reminder list. She'll send out a reminder every month so that you can come one month, fine, and you might not come for a couple, but I will add her contact in the chat, and you just reach out to her and tell her you want to be added. And if you want to be one of the speakers, we would love that.
Wonderful, thank you.
Okay.
Hey, Kathy, will you also share about the business spotlights or nonprofit spotlights that the credit union does in each of the branches while we're
Yes.
talking credit union?
Yeah, if you're a credit union member, you have to be a member, but if you're a member, we let anyone come and set up, have a huge display table. We've got about, 13,000 members that are coming through the offices, and you can promote your your organization. You can have information there. We will feature you on our website. You can even come down and physically be there at the different offices, and that's in Johnson City, 2 in Elizabeth, and in Roan Mountain. And, you know, be able to let everybody know what your needs are and what's going on. So, you know, it's hard to get your word and get your story out to everybody. So all of these little free things are powerful and good for everybody to take advantage of.
Yes, thank you. All right, anybody else have anything they want to share before we move on? A couple folks have added some things to the chat, so make sure you check out those flyers and information that's there. Last call, anybody else have anything before we move on?
I'll say, I just want to thank everyone that participated in our Elizabeth City Schools Back to School Bash. I've been announcing that in these meetings, and we had it last Monday and it was a huge success. And we probably had maybe 1,500 people, but definitely like about 750 students that we gave supplies to. So thank you to everyone that helped with that.
Yes, I just want to let everybody know, those that don't know what Volunteers of America does, in the chat, we help veterans if they're homeless or even facing eviction, soon to be homeless, to the Department of Veteran Affairs grant. So all they have to do is give us a call. I'm the outreach worker. I'll go to them or somebody will. And if you have any veterans in need, just have them give us a call and we'll see what we can do to help them. Thanks.
Okay, well, we will go ahead and move into our speaker portion. We have 2 speakers today. Our first one, I'm going to do the very best I can with your name. Hanjola Hajayi, close-ish. She is going to share with you all a project that she is working on, and I really would love for the Northeast region to have some input into this project. And so I know that you all are working with families all the time, and hopefully we'll be able to refer some folks to this project and help her out. So I wanted her to share with you all, and I will turn it over to her.
Thank you so much, Jillian. Thank you for the introduction. I also have here with me Chrissy Hatfield, who is in charge of the Reproductive and Women's Health at Tennessee Department of Health. I'll be sharing my screen shortly to talk to you about the Maternal Health Innovations Program at the Tennessee Department of Health. Thank you. Can you all see my screen?
Yes.
Oh, thank you very much. I just wanted to be sure. So my name is Angela Ajayi. You did very, very well. I must commend you. And I'm an intern with the Maternal Health Innovations Program at the Tennessee Department of Health. And I'll be talking to you briefly about the Maternal Health Innovations Program and our community listening session, which we are currently organizing. So the Maternal Health Innovation Program is a federally funded program, and Tennessee is one of the 18 states to receive this Maternal Health Innovations grant from the Human Resource and Service Administration. The purpose of this grant is to reduce maternal mortality and also attend to maternal health disparities through improving quality services and skilled workforce, also enhancing data quality and innovative programming. We know that Tennessee has one of the highest maternal mortality in the United States, and currently efforts are actually being made to improve maternal health in the state. And one of the ways by which we're trying to do this is through the Maternal Health Innovations Grant, through which we have been able to expand the Maternal Health Task Force to implement a statewide maternal health strategic plan. Also, part of the goal of the MHI is to improve maternal health data surveillance and also promote and execute innovation in maternal health service delivery in the state. So we are going to be organizing listening sessions across Tennessee to improve maternal health. And one of our aims are to understand various issues relating to maternal health care in Tennessee, and to also inform the Tennessee's first maternal health strategic plan, which is currently being developed, and also to promote collaboration between and among community members, agencies, and stakeholders in Tennessee. So we're going to be having the community listening sessions across the states, the Middle, East Tennessee, and the West Tennessee, where would have participants where people can discuss their stories, they can talk about their experiences, then can also share recommendations on issues relating to maternal health. These sessions will either be in person or virtual sessions, depending on personal preferences and location. Largely, we are looking for every member of the community who has ever loved someone, or who has ever loved someone who is pregnant or has been pregnant. We are looking for pregnant and parenting individuals, midwives, nurses, doulas, lactation support person, physicians, mental health advocates, public health representatives, childbirth educators, and I mean, the list is not limited to this, but just community members. We want to hear from you. We want to hear what maternal health means to you, and we want to hear how maternal health in Tennessee has impacted the lives of people here, so that it will help us inform the strategic plan which is currently being developed. We're expecting that each listening session will last about 60 to 90 minutes, and the main purpose of this is just to discuss maternal health issues. We want to talk about the prenatal care. We want to talk about the birthing experiences, postpartum care, and mental health support during pregnancy and after. We also would have health professionals and birth support persons who would provide recommendations. We are open to listening to every stakeholder, everyone out there, and so the list is not just based on what I've listed, but it's all encompassing. It's very wide. Anybody can actually be on board. And at the end of all this, the results of the listening sessions will be transcribed and analyzed. And these emerging teams would help us to inform the Tennessee strategic plan, which is currently being developed. So if you would like to participate, easy way to do this is just to scan the QR code to register. And if you need more information about the maternal health listening session, you can actually send me an email, or you can go to our website at Tennessee Department of Health and email anyone that's connected to the Maternal Health Innovations Program. And if you have any questions for me, I am happy to address them now, or you can send an email. Thank you very much.
Thank you so much for sharing. Any questions for her before we move on? Awesome. Okay. Thank you for being here. Their emails are in the chat if y'all want to reach out to them at any point and get involved with this study. So thanks for being here.
Thank you so much for the opportunity to share on this platform. And thank you everyone for listening.
So I am going to share next. I try in either July or August each year to share our Carter County Drug Prevention Annual Report with all of you all. And so I'm going to do that now, if I can make it work. All right, can everybody see that?
Yes, we can see it.
Okay, thank you. Okay, so sorry, can y'all still see it? It says my screen sharing is paused.
It looks like it's frozen. You haven't clicked present yet.
Okay, hold on. Can y'all see that?
It's the same screen.
Oh, okay, hold on. This is only like, what, the third year that we are using Zoom now. One would think that I would be better at this, but here we are. Okay, can you all see that?
Yes.
We're just gonna go with it this way. All right, so I just want to share with you all some of the things that we have been doing this past year. Again, this is a very small snapshot of all the things that Carter County Drug Prevention does. But I do think it's important for us to always be sharing with the community all the things that we've worked on in the past year, or at least part of them. So that's what I want to do today. The first thing I want to mention is this paragraph right here that says a conservative cost benefit analysis revealed for every $1 invested in primary prevention in Tennessee, there's a $4.60 cost savings. And so this is why what we do is so important. One of the many reasons why, but as far as a cost savings, we know that investing in primary prevention is cheaper than investing in recovery in the future. And so that's why what we do is so important. And really why we want to make sure we continue to have funding in recovery and prevention as we move forward in Tennessee. So I'm not going to read all of this to you all. I'll put the link for this in the chat so y'all can read through it if you would like. I'm just going to hit the highlights of it. Okay. So, let me get on here. There we go. Okay, so a few things to share just about who we are. We do have a 9-member board of directors. Ashley Williams is our chair, Nicole Moore is our vice chair, Kelly Kitchens is our treasurer. We always have a youth representative on our board who serves to be the voice of the youth as we primarily work with youth. Joy McCrae, Josh Johnson, Jason Stout, Jill Stott, and then also Scott Stadola are our board members right now. And so we always put in here this kind of shout out to the Carter County Collaborative, because really Carter County Collaborative serves as our coalition meeting every month. And if you aren't aware, if you're new to this collaborative, in 2020, when COVID was kind of in full force, we combined our drug prevention meeting with our community advisory board meeting and our health council meeting to create this collaborative. And since then, we have been having this meeting every month. We feel like fairly successfully, and have been able to continue to engage folks who work in Carter County and really throughout the whole region. So the funding we receive comes from Department of Substance Abuse and Mental Health Services, as well as National Recreation and Parks Association, United Way of East Tennessee, and then also the CDC. I can't say enough about our team. So we have currently 11 staff members. These people are amazing humans who almost all have lived experience with substance use in some way. People who are passionate about prevention, passionate about changing our community, and really are doing that because of the way that they care about Carter County and the things that we do. So this is our amazing team right here. Again, I'm not going to read these to y'all, but you have the link if you want to read more about them. One thing I wanted to add to our report this year is our Strong ACC partnership. We are so excited to be housing 3 Strong ACC family partners for an amazing new program. The director of that program is going to share with us next month. So please come back and listen to her share about this program. But this is something that we're very proud of and very excited for this year. A lot of the work that we do is kind of at that community level, where we are impacting policy, creating a healthier community by having events and activities and those kinds of things for our kiddos. And we really have needed that direct contact piece. We run into so many families who need more than just community level interventions. And so that's why we are excited about this program, because they will be able to offer that in our community. A few highlights from this year. So we provided 8,500 hours of classes and support to community members of all ages. This is one of the things I'm most proud of with our coalition. We all have things that we are passionate about. And so we really are able to serve all ages, a lot of different populations. Nash is very passionate about seniors, and so she does a great job working with that population. Tia has an amazing connection with the recovery community, and so she's able to work with that population. We are currently, Megan is in Carter County Jail working with the incarcerated population. And then really the rest of us, our love is for kiddos and families and mamas. And so we are all able to kind of really work with the populations we are most passionate about and most in tune with, and then kind of come together to serve really all ages and demographics. We collected more than 100 pounds of prescription medications at drug take back events this year. So that's a huge, huge thing. We know that in Carter County, around 70% of kiddos access drugs at home for the first time. And so that's something that we want to prevent. Oftentimes that doesn't look like mama sharing drugs or somebody giving drugs, but it looks like there's some medications in our cabinet that we no longer need that now we have curious teenagers and their friends and they get into. And so a huge part of what we do is making sure that people are counting their medications, disposing of their medications, locking up their medications. And this year we were able to get more than 100 pounds of prescription medications out of those homes in Carter County. Another thing that I'm incredibly proud of our team for this year is the overdose response boxes that we installed in partnership with Elizabeth and Carter County Public Library and Johnson City Recovery Center. We know that the library box, within 2 weeks, we had somebody come to us and say that they had saved a life with the naloxone they had received in that box. And so we're really, really proud of that project. Also, want to shout out to Kathleen Collins, who has supplied the Narcan for those boxes, has been a champion for us in making this a project that's able to happen. And so that's just something that we are very proud of and know is impactful, and we hope to grow throughout the rest of the region. We completed the Tennessee Together student survey in Carter County, Elizabeth and City schools. Here, I'm going to say shout out to Emily Matthews for making this happen in Elizabeth and City, and also our coordinated school health folks in Carter County for making it happen there. So if you're looking at this packet, if you scroll through to the next few pages, the kind of basic data sheet is on there for you. This is a big deal to us because we want to know what we need to be focusing on. We don't want to just be blindly guessing about what's going on in our community. And so we were able to survey 8th, 10th, and 12th graders throughout both school systems and really get their data, get their feedback, figure out what's going on with them and what we need to be focusing on to truly make an impact. Our team this year attended more than 320 hours of training and then came back to our community and provided more than 1,000 hours of training. So these are everything that you can imagine. Again, we all have our things that we are passionate about that we want to share. So everything from juvenile justice programs to maternal health programs, parenting, really anything you can think of, we try to meet the need for. And then something else we're proud of is that we received the Strong ACC Resilience Award this year. So that picture at the top is from that presentation last year. My staff also, I asked them to share their proudest accomplishments of this year. Again, everything that we do could not be done without this amazing team. And these are people who are working and living and just absolutely doing all that they can to make Carter County a healthier place to live. And so I asked them for the things that they were most proud of from this year, and you can see those on your screen here, or again in the link that I shared. The thing that I am probably one of the top 5 things I'll say I'm most proud of this year and always is our community collaboration. We could not do what we do without our partners. There's no way that we could do really a third of what we do without our amazing partners. And so we're incredibly grateful to all the people who come together, come alongside us and make these things work. This group right here is the heart of all of that. The people who every month are willing to show up, work together, hear about what's going on in the community and how we can help each other. It's really a super special thing that I don't think we see in a lot of other counties, having this many people who are committed to working together and having this community collaboration. So definitely, this is not all of our partners, so apologies if you are not on here. We love you, I promise. But I did want to share just a few things about community collaboration this year. We were able to offer 167 events and activities this year. So one of the things that we are really passionate about is making sure that kids in Carter County have safe, healthy opportunities for engagement with their families, with the community, feeling part of the community, making sure that they have things to do that are not sit at home and get bored and choose drugs, alcohol, tobacco, those kinds of things. So this year with our partners, we were able to have 167 events and activities in Carter County this year. We're also super grateful to our partners that provided us with Narcan, and those partners who were able to help us get these things out into the community. So there are lots of you who come to us and say, I work hospice, I work at a whatever, and I need lock boxes for my people. We would not be able to get those lock boxes out without you all. And so we're so grateful for that we have these partners that we're able to help us get things out to the community. And then also, I can't say enough about Tri-Cities Moms Demand Action for gun control. I don't think that Miss Norma's here today, but they provide our gun locks for us. And so we are able to give folks really a comprehensive safety package of Narcan, medication lock boxes, gun locks, and then if they are choosing to use CBD products, also a lock bag for those, because we know that lots of those products look, taste, seem like candy, and we're seeing lots of unintentional poisonings and overdoses from those products. And so making sure people have, if they're choosing to use CBD, making sure they have those lock bags as well. We would not be able to do any of that without all of our amazing partners. I have to say shout out to Recovery Resources for our Whiskey Ain't Working Anymore podcast. It's definitely one of my favorite things that I get to do. And I'm grateful for all of the people who have, sorry, will you go unplug that doorbell? It's behind that rocking chair right there. Thank you. So I'm super grateful to everybody who's been willing to come on to our podcast and share who they are, what they've got going on. We feel like it's a great way to decrease stigma in our community and create collaboration among people that may not know each other. So 50 episodes of that this year. Again, our Carter County Collaborative meeting, can't say enough about you guys. Our newsletter every month. So I want to say shout out to Tyler for both of these things. We could not have Carter County Collaborative without him, and Emily and Shauna and the rest of our amazing team. And then the same thing with our newsletters. That newsletter that Tyler sends out actually goes out, I think, to about 550 people each week with resources and data and all kinds of good things. And then in addition to that newsletter, we also have our Carter County Drug Prevention newsletter. And we have that going out to around 350 people each week or each month as well. So we hope that those are helpful things for the people in our community. And then again, I can't say enough about Emily and Elizabeth City Schools and letting us come in and do vaping cessation classes. This past year, we were really able to decrease instances of vaping in Elizabeth City Schools by about a third of what they were the prior year. So this is a huge deal for us. We are currently working towards some drug testing for athletes in Elizabeth City Schools, and also implementing this program in Carter County schools starting in the fall. So we're excited about both of those things and hope to continue to have success with these things. The thing that's most important about these to know is that we are not a huge fan of just punitive measures. We want therapeutic interventions. And so we want to, instead of just kicking them out of school because they vape or because they test positive for something, what can we do to come alongside them and help create a healthier human instead of just kicking them out? So we could not be more grateful for those things and the way that they are changing lives in the students in our community. This is the student survey data that I mentioned. Again, I'm not going to read it all to you, but there are some staggering numbers here. The last time that we did a student survey was 2019. And so as you can imagine, from 2019 to 2022, there has been quite an increase. Again, COVID pandemic had a lot to do with that. But many of the numbers that we see have really not gone in a positive direction, because we feel like a lot of things during COVID pandemic, as far as mental health and all of those things, kind of created this issue that we're going to have to continue to work on. And so you can see these ages to me are really, really important for us to notice, because our kiddos are starting to use substances much younger. So between 12 and 13 is really when our kiddos are using for the first time, whether it be prescription drugs, cigarettes, vaping, alcohol, marijuana, any of that. And so it's a good reminder to us that we need to be starting our education earlier, not waiting until high school, because this data shows us the importance of getting kiddos when they are a little bit younger. A couple other things just to notice on here is the perceived risk and perceived access. A great number of our kiddos don't feel like there's great risk associated with a lot of substances. So especially marijuana, you can see that just around half of our kiddos feel like there is moderate or great risk associated with marijuana. So that's something that we want to continue to work on, making sure that our kiddos and our families know that there is risk associated with all of these things. The communication piece, I think, is important for us, all of us as people who work with parents in the community, to be aware of, because we really have less than 50% of our students community-wide that are having a conversation with their parents about dangers of drugs. We know that one conversation can be an absolute game changer. Sometimes it just takes that one time of being like, hey, kiddo, I need you to know that I don't approve of this, instead of just assuming that they know. And so we have a lot of work to do there. We have a huge amount of kiddos who are not having conversations with their parents about any of these things. And so we have got to do better at making sure our families are talking to their kiddos about these things. The second page of the top box here, the 51% of students had seen some sort of prevention messaging. So that is encouraging to us that at least half of our kiddos are seeing the things that we and our partners are putting out for them to see. However, the flip side of that is about 45% saw something online or on social media encouraging these things. And so you can kind of see what we're up against. So while we are doing a pretty good job of getting messaging out there about dangers of these things, on the flip side, they also are continuing to see these things that are encouraging them to do those things. So just something else that we will continue to have to work on. This next part is the disapproval of substance abuse. And this is another thing, especially where we look at vaping, alcohol, and marijuana, because peer disapproval, as we know, is very important to our kiddos. And really, more than half of their peers, they feel like would not disapprove of them using these substances. And so it's something, again, that we have to consider. Our parental disapproval numbers are higher, so that's encouraging, that hopefully most kiddos do know that their parents do not approve, at least, but the peer and personal disapproval are things that we will have to continue working on. And then the last box down here, I think, is important for us to continue to always hold in mind. 18% of our students in Carter County seriously considered attempting suicide in the past 12 months. And so while It is lower than that 18.8% nationwide. Still 18% of our students in Carter County seriously considered. So this is not a mild consideration. This is, they stated they seriously considered a suicide attempt in the past 12 months. So it's just a reminder that 1 in 4 of our kiddos is struggling with some suicidal ideation at least, and we have got to be mindful of those things. You can also see the other behavioral health measures over here on the left side of this. And those numbers are scary and are unfortunate for our kiddos that many of them are struggling with hopelessness, being so depressed that nothing could cheer you up, worthlessness, those kinds of things. So again, just some things to hold in mind as we continue our work with youth in Carter County and try to serve them the best that we can. So lastly, I want to wrap up with our goals for this year. Our biggest goal is to move into a larger physical space. This space will have room for esports, game, actual sports, all kinds of resources, lots and lots of different things in that space. We will also always keep our South Hills location because we love being in this community where we can reach lower income families and be within walking distance to provide resources for them. But we do hope that we will have this second location this year that allows us to serve even more kiddos and create more healthy spaces for them to have fun and hang out and have appropriate activities to do. This year, probably my biggest goal is generating funding for our recovery and incarceration programs, because while we are solely funded for prevention right now, we do a lot of work with recovery and incarceration populations. And so we need to really work on getting some funding specific to those things. This is also our last year of drug-free communities funding. So we're eligible to apply for 5 additional years. And so we will do that year. So send all your prayers, thoughts, all kinds of good things to the CDC that we are funded again for an additional 5 years. And then you can see our goals for each substance on here as well. We want to continue working to bring these numbers down so that our kiddos are healthy and safe and have good opportunities to be successful humans. So they're all on there. And then the very last thing, the thing that you all can do for us is, again, helping with funding. If you see opportunities that you think would be a good fit for us, please send them our way. And then also volunteering. There's no way that we could do all the things that we do without our volunteers. And so anytime that, we have something going on, we always can use extra hands. Things like Tia's Overdose Awareness Day event, you all showing up as partners, having tables, those kinds of things are really how you help us continue to be sustainable. So that was a whole lot of information. Any thoughts or questions?
Hey, Jillian, it's Caroline. Just thank you for being you and your staff being such a force for change in Carter County. And, you've just really got a really great highway to the kids who can be really, really vulnerable to reach right now, and to some of our more vulnerable and often overlooked populations. So thank you so much.
Thank you.
What Carolyn said.
Thank you.
I'm always completely blown away I'm like, how do they even do all this stuff? But how much stuff you do and how effective what you do is, and it's appreciated in the community. So yeah, what Carolyn said. Thank you so much.
Thanks, y'all. We could not do it without all of you all. That's for sure. Anything else? Okay. Thanks for listening to me share all of that info with you. I appreciate you all. And again, all that you all do to help us be successful. At this point, we will move into our breakout rooms. So I'm going to ask both Tia and Emily to share a little bit about what you will be doing in your breakout rooms. So folks can join if they would like to. If y'all will just talk a little bit about what you do in your groups.
So in committee A, we're going to talk about the overdose awareness event and some of the things that I'm needing some hands-on stuff. So we're really looking for donations for food and some things like that. So that's what we'll be doing today.
And the data and assessment committee, I don't know when the last time we talked about it, but we've reduced from 3 committees to 2 committees. And so I've updated our strategic plan. So I'm going to look at that and review it. And Tia, in your committee, if you look at that whenever you get a chance and let me know if there's any changes you want to make since we've deleted one of the committees. And then we're going to probably hear from Tyler about the wrapping up our data collections for our community health assessment.
All right, thanks y'all. So I'm going to go ahead and open the rooms now. We will not come back together after committee meetings. So when your committee is finished, you are free to go. I'm going to go ahead and open the rooms now. Thanks everybody for being here.